A distressing letter written by the Henry Ford Health System has quickly made its way across social media.
Letter says, in part, quote, because of shortages, we need to be careful with resources. Patients who have the best chance of getting better are our first priority. Patients will be evaluated for the best plan of care, and dying patients will be provided comfort care, end of quote.
And this has understandably created a very concerned reaction by anybody reading it. We should point out, though, that this policy is not in effect right now. Dr. Frank McGeorge is here with the real story behind the letter, Doc.
Yeah, Kim and Devin, a concerned reaction is normal, and it has caused some people to question if they should go to a different hospital or even go to a different part of the state for their care. Let me answer that immediately. In an emergency, you should always go to the nearest appropriate hospital. Here's the big picture with this letter, though. Hospital systems across the country are drafting letters just like the one that was prematurely released by someone inside the Henry Ford Health System. In fact, draft versions of that exact letter were shared with other hospitals as medical ethicists and physicians come together everywhere to make plans as the pandemic worsens. The contents of the letter are clear. It describes the course that will be necessary when we enter crisis care and are no longer able to provide standard care, but it was prematurely leaked.
We've not initiated that protocol. We've not sent the patients any letters. And we have no immediate plan, and hopefully we'll never have to activate such a document or such processes.
While everyone is hopeful that situation can be averted, hospitals in Southeast Michigan are getting close. That's why Wednesday evening, the state's chief medical executive set the plan in motion to transfer patients to hospitals elsewhere that have available capacity. Every hospital system has similar contingency plans.
If we reach this worst case scenario, our overall goal is to reduce mortality as much as possible and provide our limited resources to all of those patients that we think have the best chance of surviving.
They want to reassure the community.
As physicians, we want to provide the best for our patients. We want our patients to do better. We want them to be back with their families, supporting their families, loving their families, and we'll continue to work with these principles. We are not going to let a pandemic change our culture, change who we are. And I want to reassure our communities that we are there for them and will continue to be there for them.
So let me be completely clear. This letter does not represent any active current policy at any hospital in Michigan, but its existence behind a virtual break glass of emergency barrier is a very clear message that if things don't turn around and move to crisis care, decisions like these will be necessary. And in that vein, I'm going to be back at 6 with something really important that everyone needs to consider. Back to you.
All right, Frank, we will see you then.